So for this installment of Ask the Expert, we are here with Alison Schure, a public health nurse with Brant County Health Unit, who is currently working in the schools and education program, but I'll let Alison explain this in more detail.
Okay.
Thank you for joining us, Alison.
Hi, Diana. Thanks for having me. So I am a public health nurse at Brant County Health Unit, and I'm in the Healthy Schools program. So what we do within the Healthy Schools, we each have a couple of schools that we kind of take on as nurses throughout the year, and it's more than just the acute care where we're kind of helping them with their bumps and bruises. We do more of the health promotion and social determinants of health planning within the school. So a little bit more intensive than just treating them for whatever happens while they're at school. So we go in, we do an assessment with the principal and the teachers, and we talk about what the greatest needs are within their schools. And there are some schools with they come from very low socioeconomic status, and lots of social determinants of health at play there. So we sit down and we talk about what the priority areas are. And then we go ahead and plan an action plan, usually with 3 goals or 3 priorities for the year. Definitely always bringing in the social determinants of health to inform our planning. So whether or not if we're going to plan a nutrition program, can the students afford to bring in healthy foods? And if they can't, then maybe we have to do something within the school system and bring the parents in as well. That's just a little piece of it, but definitely it's more higher level with social determinants of health. I'm also on the social determinants of health team at Brant, where we're trying to develop a health equity charter within the unit. We find a lot of the staff they don't have the greatest understanding of how the social determinants of health come into play with their practice within the community. So it's doing a lot of education and knowledge dissemination in that area.
Great. So Alison, oftentimes when we think of social determinants of health, we think of upstream thinking, health promotion, disease prevention. Mm-hmm. Can you give us some examples of how your role as a public health nurse in the school system is thinking proactively when it comes to early childhood education?
Sure. So the area of upstream thinking or upstream planning is more catching these problems before they happen. So downstream is more of the acute care. Once you come into the hospital, you've got asthma or heart attack that's from years and years of potentially eating poorly or not having the education or tools to be able to protect yourself from heart disease later on. So within the schools, yes, we're all about prevention. It's more early childhood education. We are in elementary schools, so we want to help these kids develop the tools and skills to prevent any detrimental effects happening to their health later on. So that's kind of catching them up here before they fall down here, where they're gonna develop these problems, end up in the ER, or as they age, they'll develop further ailments or whatnot. So that's kind of our role, is to protect them from developing that.
So Alison, one of the common criticisms we hear about some of these programs, particularly in early childhood, is that they're very costly, very intensive programs. Mm-hmm. Where some folks are not necessarily seeing the dividends paying off, or what's the value added down the road. Can you give us an example or a counter argument to that thinking?
Sure. So some of the programs that are implemented in the schools, not just with this new comprehensive school health as mandated in Ontario, so a lot of them focus on healthy nutrition and physical activity. So we have the Healthy Bites and Healthy Steps program, for example, that we implement in Brantford. The nice thing about these programs is it's not just covering one social determinants of health, it actually covers multiple social determinants of health. So we're talking about obesity prevention, food security, physical activity. So the problem with these programs is, yes, you may not see the results within a year. You may not even see them within 5 years. However, you're equipping these students and these children and their families with the tools to be able to take control of their own health. So because we're teaching them the tools of how to be physically active and helping them develop or start to value why it's important, which is also one of the priorities of teaching them these skills. Later on down the road, they'll be able to understand why eating healthy is important, why physical activity should be integrated in their daily lives, and can teach their communities about how to be more food secure. So how different food skills, we can actually bring parents in and teach them, so they can kind of that can trickle down throughout the years. So we will see the results of these programming, or of this programming rather, but it does take time.
Fantastic. That's an excellent example.
Thank
So,
you.
Alison, in closing, can you give us 2 or 3 key points that future nurses should think about or keep in mind moving forward as it relates to the social determinants of health, regardless of where they go clinically? What should they keep in mind?
Sure. I think the most important thing as nurses, and especially wherever you are within your practice, you will see a lot of things that might challenge your values. For example, potentially seeing a patient who is addicted to a substance, and not sure how you're going to be able to treat this person because you're very against that, or that's something that you don't agree with. Just really understanding the holistic patient, as you will learn in nursing school. So what brings them to this point? So thinking about all the different social factors that contributed to this person developing this disease, really keeping that in mind when you're treating a patient will help you understand, where they've come from. I think another point that's really important is when you are assessing a patient that may come to you with a very acute illness or something acute that you think is just, kind of at the surface. Don't be scared to really dig deeper to find out, if there is a reason why they're coming in to see you, or the reason why this is manifesting in this way. That also helps you develop rapport with your patients. But social determinants of health obviously can play a part in their whatever they're presenting illnesses or whatever they're presenting to you. So definitely take that time to try to understand them a little bit further. Sometimes you don't always have that time as a nurse, but it is very important for patient care.
Great. Thank you very much, Alison.
You're welcome. Thanks for having me.